We're joined by two fantastic speakers this evening, Julia Pugh and Lavinia Winch. Julia is both a psychosexual therapist and a gynecology clinical nurse specialist, and she's joined this evening by Lavinia, who in her capacity as both a patient representative and an ambassador for the Yes Organic Intimacy Company, she's a passionate advocate for women's health. And without further ado, I'm going to hand you over to both Julia and Lavinia for the webinar this evening.
Thank you so much, Helen, for your introduction, and welcome to everybody who's joined us. What a fantastic opportunity to share some information and hopefully help people as we go along. And thanks for your introduction. I'm really delighted to join Julia and Helen and meet you all this evening. I was diagnosed with endometrial cancer at the age of 62 back in 2015. And I have since that time have really made it my mission to make sure that I talk about my experiences and share my story when I can, so that it can help other people who might find themselves in a similar situation. And that's really why I'm here tonight. I am an ambassador for the Yes Organic Intimacy Company. We have a range of products which I myself have found incredibly helpful, and they are recommended by a lot of leading gynecologists and cancer specialists. So they can make a real difference in terms of comfort and intimacy. I'm sure I'd like to hand over to Julia now.
So thank you very much. Yeah, my name's Julia Pugh. And I work at the Trustee Hospital. I'm a gynae advanced nurse practitioner and psychosexual therapist, and I'm delighted to kind of have the opportunity really to talk about this area that is, as clinicians, we're not always brilliant at talking about. So I'm passionate about my work directly with patients and couples, and to kind of help people on their recovery journey. But also I'm really passionate about speaking to clinicians and doing training with clinicians about how hopefully opening up the conversation. And I don't know how many of you may have had a conversation with any one of your clinicians about this area, but if you hadn't, it might be because you didn't feel comfortable about bringing it up, they didn't feel comfortable about bringing it up. And so we just, hopefully things like this sort of webinar will help to talk about the issues and hopefully empower you in any of the issues that have been raised. So some of the things that we're going to be covering today, I'm going to kind of talk through quite a few slides, and some of the previous questions that we had sort of submitted before this webinar were talking about libido or sexual interest, sexual desire, and those sorts of questions are really, really common, and I hope that what I sort of discuss will really hopefully give you some guidance on that and some thoughts and ideas that might be really things that you can apply. Also, we had some questions around sort of practical hints and tips, particularly about dilators and things. So we're going to leave the practical hints and tips and bring Lavinia and Helen back in at the end, so that we can talk through some of that that would hopefully be some real take-home messages. Obviously, you've got the chat box, so please do put questions or comments in there, and we will try to answer them as well. And there will be some opportunity at the end for anything additional. So what we're looking at is we understand that things have changed. So, you know, when people have had a diagnosis and any of the treatment that you might have had, and we're going to look at why and what's changed. We're going to look at what makes you who you are, and so things around body image and how you feel about yourself. Common problems that people talk to me about and talk to others about that might resonate with you, and then how we sort of go about addressing them. So this might be the first time that you've ever sort of sat and listened to sex education in a way, apart from when you were at school perhaps, and it was all very awkward. And I think we do in general not talk enough about, you know, how sex works, what happens when there are issues and things like that. So the sexual response cycle is really about understanding that and recognizing that it's a mind and body working together, and hopefully helping give some guidance around that. Pleasure is probably the thing that I talk about most. You know, what is it that you're after? And often some of the issues that we are dealing with is because they're stopping you from enjoying something that you want to get pleasure from. So we will talk about intimacy and partners, and also looking for a new relationship if that's relevant to you. We'll talk about how to learn something new, and where to find help, and then we'll be moving on to the practical hints and tips. So what's changed? There are a number, obviously we don't know who everybody is, and we can't, the nature of these webinars is that we don't, we have a lot of different people who might log in who've had different types of treatments, and depending on the stage and grade of your disease you will have, and where you've been treated, etc., you'll have different things that you might be, different modalities of treatment. So for those who've had radiotherapy and chemotherapy, particularly fatigue is a really big issue. Obviously surgery can have significant issues in terms of changes to your body image, or how you feel about your body, and scars that are left as a result, anatomical changes, and just understanding and thinking through that. So when you begin your treatment journey, often people talk and it's not until later on that you're trying to piece it all together and figure out what exactly has happened. I think a lot of the times people, we give a lot of information at the treatment journey, and sometimes, as I said, it's sort of processing things and wondering what is going on. And so that's particularly relevant around radiotherapy in terms of the latent effects. So if people have had radiotherapy or brachytherapy, those latent effects being the long-term impact, so or effects that can turn up a bit later on. And that is sometimes really difficult as well, depending on where you are in your recovery journey. I talk about chemotherapy as well, and it being this sort of, the risk of infection, and it can really frighten people and make you very cautious about engaging, and if we also be for your relevant for your partners and how they feel. So overall, many people who are going through a surgical menopause, as an example. We are going to talk briefly about menopause, but we know that it's a very hot topic. There's lots, and I also know that Peaches are going to be doing quite a lot on it in September when they do another event. So I know it's very relevant for people as well, but it's something that, again, everybody's different in terms of what they deal with and the side effects, but there's lots and lots of help out there. So depending on what you're struggling with, hopefully you can find the help that you need. But the last thing is that it's a life event. It's a huge thing that has happened. It's your own sense of mortality. It causes changes in your role. So whether you're in a disruption to your life in general, and ultimately where you thought you would be at this point on the 12th of May, in 2022, where did you think you'd be? And for lots of people who've had a cancer diagnosis, it's not where they expected. And so changing the outlook and the way things are is also something to adjust to. So this is a slide just about some words that patients have used with me around what they think. If I asked you to describe yourself, and how you feel about body image, is feeling comfortable in one's own skin and feeling comfortable in one's own body. And when you are going through treatment, a lot of the time you can, that is a huge disruption. And there are lots of words on here that I think can really resonate with people around, losing that sense of health and vitality, or that trust in one's own body. And particularly depending on how you've got to diagnosis, and not knowing that things were changing or growing, or not being heard. So kind of the idea that if you had symptoms and you were telling people about your symptoms and they weren't being listened to or acted on, that can really disrupt this sense of trust for your own body, but also, what do I do now? And that sense of ownership and control. And then obviously the role changes that we talked about, and the identity shift that can happen when you have had a cancer diagnosis can really shape and change things in terms of how you feel about your worth, or esteem is another word that people use. So femininity and sexuality are very sort of broad umbrella terms, and some people will resonate with them and some others won't. And appearance is often the thing that we always talk about, but actually a lot of it is how we feel on our own bodies. So what I would say is, this, I think for those of you who've signed up today, it's because you feel that this is something you'd like a bit of knowledge on and support with, but it's sometimes also recognizing that you're moving from a place of survival. So when you have a diagnosis and you're going through treatment, you're in that fight or flight, you're just getting on with it, you have to, and it's tough sometimes to kind of get back into that space where you want to go kind of engage in normal activities or normality. And sometimes you can feel like you're moving towards some sort of normality, but actually something triggers you back. And that can be around scans or other sorts of things. And so it's just a recognition of where you're at and how you're feeling and your psychological well-being. But it's really difficult when I talk to people and I'm listening to what they're saying and I'm thinking, actually, it sounds like you're still in fight or flight. And that's really difficult then to talk about this lovely hotel bedroom or the metaphorical bedroom and this lovely, weekend away or those sorts of things, or enjoying sexual pleasure, because actually that's really difficult when you're just your brain is just like in survival. So there's a bit of just checking in with yourself about where you're at. And that's the same here, really. It's just, are you ready? Are you ready for, it might feel like there's something that you're missing, or that you want some sort of normality in terms of a sexual relationship, or you recognize that there's been disruption in that sexual expression and you don't quite know how to get back to a new place with that, and everything has shifted. And shift continues to happen, and it is about kind of engaging with this sort of support. Sometimes you might need some one-to-one support, and we're going to talk about how you might get support in the future. But it's also about what you're ready for. So there's a picture of women kissing, there's a picture of people lying in bed, and it's like, what are you hoping for, I guess? And a lot of people will talk to me about actually just wanting some closeness and some intimacy. Lots of people will talk about just wanting to feel comfortable in their own bodies again, and self-pleasure, self-acceptance. But we also recognize there's lots of roadblocks to these things, and wondering and thinking through, what are those things that are the things that are stopping you from doing that? Acknowledging them is a really important thing, and not feeling too overwhelmed by all the roadblocks as well. So these are some of the common problems that we have, that people will have after having had treatment. And I'm going to put them up and just give you a couple of minutes just to have a look at them. See if any of these particularly resonate. So it's always really hard on a webinar to wait. But one of the things that I want people to think about is actually which one of those sort of fits with your experience, and maybe none of them do, maybe several of them do. I think that it's important for us as well to recognize those who we can help in terms of what is it that we can address. So pain is, a really significant one. People experiencing pain. Where is that pain? What is that pain? Is it just related to sexual activity, or is it related to just a general pain that kind of stops your brain from getting into that space of enjoyment and pleasure and those sorts of things? The idea of, I don't feel anything down there, it's not mine anymore, is again something that I hear quite often about people not feeling like their bodies are their own anymore, especially if you've had radiotherapy and brachytherapy and surgery, or even every type of treatment can make you feel like you want to disconnect from that part of your body. People can also develop fantasies about what's going down there, what's going on, what's up, what's happened. And that can be really difficult as well. So thinking through some of these things. We've tried, but it was a disaster, is something that we, happens so often. We're hardwired to avoid pain, particularly psychological pain. So or emotional pain, if we've had we've tried something and it went wrong, we generally don't want to go back there without a lot of coaxing and convincing and steeling ourselves and willpower. So, it's just recognizing if something, you've had a difficult experience, or it was tough, you might feel like, I'm just not going to do that again. And recognizing that and feeling, then wondering how you might make those steps to go back to feeling confident enough to try again. I should be grateful I'm alive. How can I ask for more? So this is something that I hear in terms of, particularly around the cancer diagnosis, when you've been given something that has sort of brought your mortality into question. You are scared and worried that, ultimately you should be just happy where you're at, and that it's difficult then to start asking, well, I've had all this life-saving treatment, but what about this? My life and how I feel about myself is changed and shifted so much. And sometimes, who can help me? How do I get that help? And especially if you've not found that your clinicians have been particularly forthcoming about opening up that conversation, about normalizing it, saying it's okay to talk about how you feel about your body, sexual pleasure, self-love, intimacy, partnerships, all of that sort of thing. I'm not interested, but I want to be. So, that is also telling us a lot about what we heard from the questions that came in before the webinar around desire. And it's really important that we recognize, going back to that idea of fight or flight, from survival to normality. When we're in fight or flight, that is, very far from our minds, and stress blocks desire. So the idea that we are just, in a stressful state, we're unlikely to be opening ourselves up or receptive to things that might stimulate us, things that might pique our interest. And we'll go on to talk about responsive desire as well later on. And then the worry at the bottom, which is the one, if I can't, they'll eventually get bored and leave. And this idea that, there's a worry over the relationship as well when things, and not, there's so many strains on relationships if you've got a partner when you're going through treatment anyway, that it is a real difficulty. And sometimes we just need to acknowledge that and then see where we can move forward. Okay, so it's not all about sex. The idea that that the pictures I've got here is that this one is meant to be a mirror, and it's about how you feel about yourself when you look in the mirror. And hopefully I've sort of explained that. It's about communication. So that if you can't see that cartoon, it says actually Peter had misheard Brenda. She hadn't begged him to stimulate her clematis. And it's just that idea of miscommunicating with each other and not really, getting there sometimes and feeling unheard and that sort of thing. And sometimes it's those intimate moments of sitting and holding hands that you also miss out on when this part of your life has been disrupted. Okay, so the interplay. So I've talked a lot about kind of sexual things, and I just like to sort of highlight to when we're talking about this area, sort of breaking it down. So we've talked, the sexual function is around, the physical elements of sex and sexual intimacy and sexual pleasure, and that's when we go on to talk about the sexual response cycle. That's some of it, but then there's also the sexual identity. So that's how you see yourself as a sexual person, and those things about positive body image, about looking in the mirror, feeling comfortable, trusting your body, expressing yourself as a sexual person. And that can sometimes be a shift and a transition that's difficult after you've had a cancer diagnosis. Like, how do I feel sexy again? How do I, go out into the world and feel like I can express myself in that way? And then there's the sexual relationship, and that sexual relationship can be a partnered relationship, but it can also be the relationship that you have with yourself, and that's really important. And the whole idea of these three circles is that no one thing is if one thing is disrupted, then it's difficult for the other two to be okay. And so it's really working on those three things. And also in terms of those common problems, it's actually thinking, where are those issues and what is it that we can do to help improve them? And when I referred to the roadblocks before, it's very much about, thinking, where are these roadblocks? What's stopping me from moving into a better space with all of this? So this is the Basson model of sexual responding, which is something that I use a lot with people, and I find people really understand it, because previous models of sexual responding have been a very linear sort of process. So you start with desire and you end up with an orgasm, and that's it. And we know much more about, particularly around sexual feminine sexual expression and sexual response, that actually it's so much more than that, and there's lots going on, and it's not just a time linear process. So this is it is a process, and usually if you've had a positive experience, you're likely to have another positive experience. That it's not just about penetrative sex or an orgasm. Satisfaction can come physically as well as emotionally. So this could be a kiss with a partner. This could be about some self-pleasure and self-love that doesn't necessarily end in an orgasm, but you feel more connected with your body, and you've come to that space and that calmness of being connected with your mind and body. So to explain it, you start from a place of emotional intimacy, but you're sexually neutral. So emotional intimacy is a bit about what I talked about before, in terms of the fight or flight and that kind of thing. So you're feeling okay in yourself. You're also feeling okay in terms of the relationship you have with the world and everything outside it. So and you're not in a stressful state. You're sexually neutral, so you're not thinking about sex, but you're not thinking about it. There's nothing that's turning you off. There's no massive roadblock in the way, like pain as an example. And so then you kind of find something receptive, or somebody or something finds you receptive, or gives you that sort of initial thought or idea that you're moving away from sexual neutrality to starting to think about it. And this is, really can be really important in terms of talking about desire, because actually we need to be looking for those things in order to kind of move from sexual neutrality. We can't, there's a myth, I guess, around people expecting to have lots of spontaneous desire, and that you suddenly start at the top with lots of spontaneous desire, and that's not always the case. So it's thinking about what would be the things that would spark your interest. And anticipation is probably one of the biggest things that people will talk about. So things like setting aside time, knowing that there's that space, being relaxed, being comfortable, making that time with a partner if you've got them, or making that time for yourself, and setting a scene, setting a space, and looking forward to that. And that's sometimes where that sort of, you're moving away from that, and that could be a few days before, it could be a few hours before, it could be a few minutes before, but you've got that anticipation, and that helps to move you into a place where you've got a little bit more interest. And then you've got the biological and psychological factors that are all influencing that sort of process. So then once you're comfortable that things are kind of moving forward and that you're in that sort of situation, you're then thinking about that physical stimulation as well as what's going on in your brain. And a lot of times people will be moving away from, that if you've got worries and concerns, you'll be escaping, if you like, and moving and sort of exiting the process by thinking, oh my goodness, no, I'm really worried, or last time it was a disaster, or I should be doing something else, or what if it hurts, and all these sorts of things. And that can be complete break in that mind-body connection, and therefore you don't get to that point where you're feeling sexually aroused, where there's that mind-body connection. But if it's all working together, you do start to feel sexually aroused, and you can notice those changes in your body, but you can also start noticing the fact that you're switching off. So you stop thinking about putting the bins out or what needs to be done tomorrow, and you start going, yeah, I'm gonna, and your body and your context, is all saying, yes, keep going, and you want to keep going. And this is also where the desire starts kicking in. And so often people will talk about responsive desire being in that space, and then feeling the sense of, yeah, I'm enjoying this, I'm wanting to continue. And as your arousal increases, so your desire for more. And that's when you get to a point of satisfaction. And as I said to you before, it doesn't have to be an orgasm, but it can be. And it can be that physical and emotional sense of, yeah, I've enjoyed that. I would want to do it again. And that's where we've got, like, if you like, I sort of talk about a piggy bank in that top space between the satisfaction and the next bit is you know, when you've had a positive experience, when you've enjoyed, you've had pleasure, you've enjoyed it, it signals to your brain, it's putting money in the piggy bank going, yeah, I'd like to do that again. So I've mentioned mind body a lot. I like this cartoon in the middle of like recognizing when you're all over the place and everything's just not right. And that would be that middle stick lady is going to be that sort of time when you're in fight or flight. You don't know which way is up. You're just kind of getting on with the next thing. Sometimes you're moving away from that, where you're just in your head all the time, and you're also maybe getting signals from your body and you're thinking, oh, is that right? Is that not right? And this can happen, like we said, in those trigger times where other things are happening, you know, particularly around fatigue. This is where, you know, you feel like you've got no energy and things, and that everything is completely draining. That can be a real disruption to your mind and body working together. And then the other side, where it's all like a nice circle, that's when you're in tune with what's going on. So how do we do this? We need to set time aside to look after ourselves. Self-care is something, a really buzz term, and lots of people like to use it at the moment. And it's important that we kind of move to that, look for those opportunities where we're looking after ourselves, but we're also creating opportunities where we might go into that kind of space where we want to be intimate and sexual, either with a partner or by ourselves. Communicate or miscommunicate, it's such a big part of how successful we are at a variety of different things. We often get caught in a trap of just mind reading, thinking that the other person is thinking something, or avoidance, and just worry about it all being too awkward when we're in a partnered relationship of not in, and therefore not engaging in some of those difficult conversations, or being able to express ourselves in a meaningful way. That then just feels like we're very separate. I would also say, you know, being tuned into one's own self-talk is really important. And again, another thing around mindfulness that we're aware of at the moment, recognizing thoughts that come into our heads, but then what we do with those thoughts is the next thing that we can control, and need to exercise those that in order to sort of be receptive to negative thoughts, particularly that come into our mind, and how we sort of deal with those. So partners, I think it's useful just to have because, you know, partners are on the other side of this, for those people who are in a relationship. And these are some of the things, I'm not going to go through them all, but, you know, if you're not communicating about it, sometimes it is really tough for the other person, and it can be, there's a sort of agreed silence, and you're wanting to protect each other, or you're thinking that the other person's not interested, or you're embarrassed, and it is just sometimes a miscommunication or a lack of communication, and sometimes a very simple conversation can help. I would also say that partners also feel, if there's been that things like, you know, cuddle and a kiss, or holding hands, or those sorts of things can be the signals. You know, if we go back to the sexual response cycle, can be oh, that means that they want to have sex, and so they withdraw from doing any of those kind of nice intimate things, because they're worried that those might be signals that people, especially when there's been a hiatus, aren't ready for. I often hear partners and patients say, I'm just not sure I'm ready. And so that's where we go back to that first slide of, are you ready? And what is it that you're ready for? And having that conversation. So it is about learning something new. So most people have had many life experiences apart from their cancer diagnosis, but that often feels like a very prominent one, and obviously why many of you are on here. But you've got other experiences to draw on in terms of learning something new, in terms of adjusting. So that might have been different relationships, that might have been different times in your life, that might have been children, it might have been the menopause, it might have been a number of different things where you've had a change, it's shifted, it's had an impact on your sexual intimacy, it's had an impact on how you feel about yourself as a sexual person, it's had an impact on your relationship. And it's thinking through, what skills and tools did I have then? And, thinking about what you want, thinking about what the barriers are, sharing responsibility. So if you're in a partnered relationship, that might be about that communication. It might also be about saying, actually, I need some help, and where do I get that? And not feeling like you have to have all the answers yourself. I'd say you're in training, so setting aside time if we want to get better at anything, if we want to be stronger, fitter, healthier. If we want to eat well, we're going to put effort and energy into our cooking. If we want to be fitter, we want to put effort and energy into our exercise. And this is just the same. We need to put that time aside and recognize that it's a process and a progress. We're not going to have mind-blowing, fantastic intimacy with ourselves or other people if we don't put any time and effort into it. And reframing intimacy, what does it look like? What do you want? And think outside the box. It doesn't have to be what has always been. It could be a number of different things. And this is an opportunity. There's always changes that we can engage with as well when we're trying to learn something new. So finding support, there are a number of different places that you can find support. Sex a fairly new sort of initiative that has many different things. It talks a lot about creativity, and that also just trying to open up the conversation. So that's really important. There are a number of, when we talk about practical hints and tips, we're going to talk about places where shops where you can go to get sexual toys and devices and lubricants and things like that, which also often have some information on there. Sexual Advice Association is an app that you can get, and that has some really useful information on it. Mind the Gap is a great book by, she's called The Sex Doctor on Instagram and social media, Dr. Karen Kearney, and she wrote this book around desire and the myth around female sexual desire and how responsive desire and how we can manage that. And then Emily Nagoski wrote a great book called Come As You Are, which is also about understanding intimacy as well. If you do feel that you need to have some specialised support, then there's the Institute of Psychosexual Medicine, there's the College of Sexual and Relationship Therapy, and there's the Relate Couples Therapy as well. And all of them have spaces you can find therapists, but also information on there to sort of give you and guide you. And then obviously all the charities, there's some fantastic charities that are talking about it, and such as we are today. So I'm going to move on and talk about practical hints and tips, and I'm going to ask Helen and Lavinia just to pop their cameras back on. There's so much narrative and talk about it at the moment, and particularly around HRT and all these sorts of things, and it can be quite isolating for people who've had a cancer diagnosis, because those sort of options aren't always true for people who've had a cancer diagnosis and treatment. What I would say is, it's about track and control. So I think some of the apps where you can track your symptoms is really important, and that can be really helpful just to give you a real idea of what are your main problems or issues and when do they occur and how can we get over them. There's some great evidence around cognitive behavioural therapy and some of the ways in which that can really tackle some of the vasomotor symptoms as an example, but also there's lots of research being done into other ways in which that can help. But it's also about what you can cope and manage with. So others might, feel that it's quite tolerable to have certain symptoms, and others feel that that's completely disruptive for their lives. And so it is about you and your journey and figuring out where you might get support if it's unmanageable. And there is you know, a lot of information out there, but it's really about tuning in and asking the question, what's the evidence? And hopefully the event that Peaches are putting on with the menopause specialist, you're going to have some of that information there. So I hope that that's okay. So I was going to move on. Is there anything that Helen or Lavinia wanted to add to that?
Yes, it's very small down there, the vaginal and vulval symptoms that are related to lack of estrogen. So some of you listening may already have been through menopause or be perimenopausal, and others may be very much younger, and may not be aware that having had a hysterectomy, if you don't have your ovaries anymore, a lot of your estrogen is developed in your ovaries. And so one of the side effects of that is the fact that you can be much more uncomfortable in your vagina and in your vulva as well, and it can also cause some bladder symptoms as well. So I think just being aware of that is really important, and it's not something that we talk about very comfortably, but it is one of the most common symptoms of menopause, and obviously after having had a hysterectomy.
Thank you, Lavinia. That's a really good point. Okay, so there were some questions around dilators and post-radiotherapy, post-brachytherapy, and not everybody this is going to be relevant for everybody, and dilators can be recommended. So the international guidance after brachytherapy is that people start using dilators after 4 weeks of treatment, and they're using them 5 minutes a day, and the intention is to reduce the likelihood of getting the latent effects that we talked about. And sometimes these effects of the radiotherapy, and there was a question specifically around vaginal stenosis, and stenosis being what does it all mean? What is it? You know, what am I looking for? Stenosis is essentially a lack of elasticity. So unfortunately, that's one of the side effects that can happen, and it doesn't always to everybody. But I put on here a variety of dilators, and there are people that use dilators not in this context as well, who may benefit from just using the dilators to feel more comfortable about penetration and penetrative sex as well, or penetrative pleasure. And that is really important. If it's something that you've been recommended to use, that you're feeling comfortable and confident about it, and it is something that isn't always brilliantly done. And I know that we were talking before the webinar that Joe's Trust have some excellent information around brachytherapy, and you know what can be done afterwards in using dilators. The idea that these are graded, so you can start with the smaller versions, and then you can progress up as you feel you need to. It's something that we as medical professionals recommend, because people need, you know, we want to obviously try and avoid the stenosis, and you know, it's still important for examination as well. So some people don't want to engage with the dilators because they feel that it's, you know, too difficult, or that they're not going to be engaging in penetrative sex. But it is still recommended, so particularly for examination in the future as well. But it is difficult. I think, you know, one of the hardest conversations that for us, if, you know, talking to people about these things, is that actually it feels very clinical sometimes. So the ones that you can see, I don't think I've got a pointer actually. Yeah. Ooh, there you go. These ones are often the ones that people get given out at hospitals, and they're very clinical and plasticky and hard plastic and not very nice. And there's these other ones that are available that are much more you know, easy to use, and got a rounded top and silicone and those sorts of things. And then Pleasure Solutions we'll go on to talk about, but they're a company that have made toys and devices, and they are, you know, medical grade silicone, and they can be used in a similar way. So it can be really, really useful. I think it is difficult. Not everybody will need to use them at all, and the idea that you're having to use them on a daily basis. It can be a very unsexy thing to do, and it's about framing that. And so if you're struggling with that, please do contact your team to talk through how that might be better. Lavinia?
Yeah, Julie, yes, I think what I'd just like to say here, we'll be talking about lubricants and vaginal moisturizers a little bit later on, but it is important to use a lubricant with a dilator, and you can use a water-based lubricant, or you can use an oil-based lubricant with the silicone dilators, but you shouldn't use a silicone lubricant with a silicone dilator. That isn't not a good thing for the silicone. And both of those ones along the bottom, the calixotics and the Soul Source, that's the ones that are graded in size, they are both silicone and they are flexible. They're not hard, whereas the ones that at the top left that are available usually on prescription and may be given to you from the hospital, they are actually plastic. Some people get on with them, but it's a question of perhaps trying what's right for you, but really important to use a lubricant with a dilator.
Okay, so vulval and vaginal health. Ooh, sorry. So we're going to put in the chat box the British Dermatology Society information around vulval health. And this is something that, again, we don't really talk about ever. And that is how do we look after the vulva? So the vulva being the outside and then the vagina being on the inside. And how do we look after those areas and manage that? So we talk a lot about using washing, and we would recommend no soaps that are perfumed, or any soaps at all really, lotions, potions, talcum powder, anything like that. But we do recommend using a soap substitute like dermal that we've got down here, or there are other oilatums that you can use that are soap substitutes. And you can wash in that way, and these are okay to be used in this intimate area. Also, what we're looking for is moisturizing the outside. So as Lavinia said, particularly postmenopausally, you are likely to have some the estrogen that serves the vaginal moisture also serves the vulval area in terms of obviously it's all connected together. And so you can get a dry, the vulval area can become dry and irritated easily. So moisturizing the outside using dermal or oilatum, also coconut oil, obviously as long as it's organic and not got anything else in it. So that's one thing that we need to do. And then, but moisturizing the vagina is separate, and that's moisturizing on the inside. So vaginal moisturizers, we've got the Yes vaginal moisturizer, which is organic, and you've got the picture there that shows the little pessary, so it's easy to apply. There are others like Silk, but just be mindful if you've got any kind of kiwi allergy. We've also got Hyalofem there. That's another one that's mentioned because it's also a non-estrogen based moisturizer that can be used, and these things can be really useful in terms of just engaging and thinking about and wondering, especially if you've got pain or discomfort, what you're thinking about when you're sort of attending to washing and moisturizing, what feels good, what feels and what doesn't, what might feel uncomfortable, and how you might improve your vulval and vaginal symptoms by using this sort of regimen. Helen, Lavinia, anything else that you wanted to add there?
Helen, I know that you have a special interest in vulval dermatology and vulval, so I'm sure you, and there's something else I would love to add as well, but let's you go ahead.
It's just really to sort of reiterate what Julia said, and she said it beautifully. It's that this is sort of almost special skin. It's not like anywhere else on the body, so it should be treated delicately. It's really easily irritated by a lot of common products that are sold over the counter or on supermarket shelves. and they still have perfumes in despite being advertised that they're for intimate feminine areas, and I would just avoid them if possible. So bringing in an emollient cream, a soap substitute for when you're washing, and you can also use that as a moisturiser externally. And to avoid getting your shampoo or your shower gel on the vulval area during a shower, and to help with that, you could apply an emollient before you get in the shower so that the vulval area is protected before you start washing. And then to sort of help with the minimising the irritation on a daily basis is obtaining a barrier cream, which is like a greasy ointment. The commonest one that I prescribe is called Hydromol, and you can buy that from Boots. You don't have to have it on prescription. And I always say to people, put it on liberally and put it on like you would nappy cream on a baby, put it everywhere. It's got no steroid in it, it's got no hormone in it, and it just adds a bit of lubrication to that area so that you don't get irritation from your underwear or just from sort of general walking around and movement would be my sort of main recommendations for vulval care, really.
Yeah, what I'd love to add is be comfortable about using a mirror to have a look at your vulva. You know, I've come across people, I sometimes give talks to women that have had breast cancer or gynecological cancers, and quite often they say to me they've actually never looked at their vulva, so they don't know whether there might be some changes. I think it's really important. And if you're feeling sore and irritated, it might be a little bit of thrush, but it may not be. It may just be a little bit of dryness. And some of the products that that Julia and Helen have mentioned may help. But yeah, familiarize yourself with your vulva and make sure that you notice when anything changes. You know, feel comfortable about looking and seeing how it looks.
Brilliant, thank you very much. So, my mouse has gone. There we go. No, there we go. So this is all about lubrication and pleasure. So we've talked a bit about lubrication already, but as Lavinia said, we've got water-based lubricants, oil-based lubricants, and there are silicone-based lubricants out there as well. And yes, have these sort of the different oil and water-based. And when we talk about the double glide method, which is when one partner or is using water-based and one partner is using oil-based, or you're using one on a toy and one on yourself, these things can be really, really helpful. It's all about reducing friction. That's particularly relevant for you know, for less discomfort and pain, and especially if you're you know, getting back to, or you've had some period of where you've had some irritation and difficulty, or you've got dryness, you know, lubricate and use them liberally. I would highly recommend. And then there's these other products I've previously mentioned, Pleasure Solutions, that they were all about creating toys that were, and devices that were you know, less sort of obvious, if you like, and more for people that have had changes after cancer. So the one that you can see, that I think that one looks like a turtle, and it's about stimulation, and that not necessarily for penetration, and they can be really comfortable, and again, they don't look too sort of over-facing for people that haven't used toys before. And then there's the O-Nut as well. So the O-Nut is a device that was put together, well, that came to market really about people that struggle with penetration, and particularly deep penetration. So if you've had surgery and you've had some, you know, you've been told that you've had a reduction in this in the length of your vagina, that obviously the vagina is a very elastic and will, but some people still struggle with deep penetration, and that, and we're worried about that and be uncomfortable with that. And the O-Nut is basically sort of a buffering, if you like, so it can be put onto a toy or a penis, and it helps to just reduce that and makes both partners feel a bit more comfortable about engaging in penetration and not having to have too much difficulty. Joe Divine and Shush are two great sort of websites where you can get information, toys, and look at what's out there. And all the lubricants are also on there. And then there's pelvic relief as well that you can look at for the owner and the others. Lavinia, is there anything you would like to add to that?
Yeah, I noticed that we had Sarah Jane on the chat when we were talking about communication. She basically said communication is lubrication, which I thought was really nice. Yeah, I think it's important to a couple of things really, and this is certainly an area where I've had issues that have been very challenging, and I was just hugely lucky to be very familiar with the products that could help and also knew where to ask for help. But the difference between a vaginal moisturizer and a lubricant, I think it's important to say that the vaginal moisturizer is something that you'd use on a regular basis, possibly even daily, particularly one that's non-hormonal, like the SVM. You can use it as often as you like, and it's for long-term use, whereas the lubricant is specifically for sex, or for self-pleasuring, if you're using a toy or something, and with the dilators that we mentioned. And then the difference between the oil and the water. The water is a very natural gel. It's designed to be very similar to your own moisture. It is actually made from plant-based gums, very, very natural, but it does get absorbed fairly quickly, and that's where the oil-based can be really useful, in that it's a plant oil-based product. It doesn't have any mineral oils or chemicals in it, and it's much longer lasting, it's much richer. And you mentioned the double glide. I mean, certainly you can apply it. The important thing is to have the oil first, or the oil on your vagina, because that's what is going to give you the protection if you are dry and uncomfortable. And then the water slides over the top. So that's what we call the double glide. And the O-Nut is really fantastic. I'm going to be, honest here and say it's something I find really helpful. It is important that you have fairly good communication with your partner, that you can explore this and that your partner is happy to try this. But it's a collaborative thing that it's really great, because if you have a partner and he feels that he doesn't want to hurt you, it's really, really good from that point of view. It means that he can feel confident that he's not going to be coming in too deep. And it's a very nice sort of silicone product. It's been highly recommended by lots of psychosexual therapists, and certainly it was something that I found really helpful.
Brilliant. Yeah, and I would just say there are lots of things out there that you might find useful and helpful. I think that it is challenging if these haven't been part of your sex lives before, but this is an opportunity for new things and thinking outside the box as well.
Julia, I should have just mentioned that you can ask your GP for vaginal moisturizers, and also some lubricants. Certainly silk is available, and yes, water-based is available on prescription, and the SVM is also available. It comes either in a tube or an applicator. The NHS are trying to make people buy them over the counter, because you can buy them over the counter, but my feeling, a very, very strong feeling, is that when you've had cancer treatment, you should be able to get your prescriptions free. So you should be able to get these products that are going to help hugely on prescriptions. So we need to continue to campaign to make sure that the NHS still is happy to prescribe these products, particularly if you're postmenopausal or post-cancer. So keep trying. If you have any difficulty, just push.
Okay, thank you. So yeah, we're sort of heading to the end really, and it's just a reminder really of where to get help, where you can find support, and please do share if you've got other places and spaces that you found beneficial. There's lots on social media around this, and we're certainly trying to talk about and raise awareness about the sort of narrative around how people might think and feel about themselves and their intimate well-being after sex, after cancer and cancer treatments, and I hope that this will help to open up conversations for yourselves and with many other people.